Hello, this is Leslie Walker-Hirsch, and today it is my great pleasure to be speaking with Dr. Nurse. It's an interesting combination, with Dr. Brooke Faught. She recently earned her doctoral nursing degree as a doctor of nursing practice from Vanderbilt University and is also the recipient of the Founders Medal for First Honors. She is the director of the Women's Institute for Sexual Health in Nashville, Tennessee. Welcome, Brooke. I'm happy to see you.
Thank you, Leslie. I appreciate this opportunity.
So tell us, how did you become interested in nursing?
Yeah, growing up, I was always interested in caring for others, and I just kind of felt led into nursing. And very early on in my nursing experience, when I was in undergraduate training as a nursing student at Ohio State, I knew that I wanted to advance on to become a healthcare provider and have an autonomous role to care for my own patients. That required further education to become a nurse practitioner. So in 2003, I graduated with my master's degree from the University of Pennsylvania as an OBGYN nurse practitioner. And the reason I chose that role was because I just really felt led to caring for women. And that was from birth until death. I really felt that I connected well with women. I enjoyed primary care, urology, sexual medicine, OBGYN. I enjoyed the entire spectrum of women's healthcare. So because of that, I chose that specialty, and that's different actually from traditional medical training for physicians, where they come out as generalists and then they specialize in the residency. Nurse practitioners choose to specialize before they go into their master's training.
So you knew in advance the direction you were going in. Now the WISH Clinic, the WISH Women's Health Institute, is part of Urology Associates in Nashville. And how did the two of you find each other?
That's a great question. It's such a great story. In my first role as a nurse practitioner, I worked in infertility, and I loved my patients. I loved working with complicated hormonal conditions, but I really desired to have my own practice where I actually could see my own patients and care for them from the beginning to the end and develop relationships. I also really liked urology, and I really enjoyed sexual medicine, and so I kind of sought a position that would merge those two worlds together. Urology Associates was looking to expand their women's services. This was back in 2005. And through a handful of conversations, we realized that we had some mutually beneficial opportunities that we could work together upon. So essentially, they hired me and they gave me a period of time to go out and learn and research, do a couple of preceptorships, attend as many conferences, read as many books as possible to gear up in the realm of sexual medicine. And I was really lucky because where I trained in Philadelphia, Dr. Susan Kellogg, who's also a nurse practitioner, she has her PhD, ran a sexual medicine practice, and she continues to run that. So I was able to connect back with her, do that preceptorship, and bring that knowledge back to Nashville, where I was able to assimilate it into the current business model of Urology Associates. So I believe it was in November of 2005 that we launched the WISH Clinic as a subdivision of Urology Associates.
How exciting, and Nashville must be very appreciative to have that kind of service. So I've mentioned already that you are a recent recipient of your PhD. So what was your research project about to earn your PhD?
Yeah, so technically it was a DNP, Doctor of Nursing Practice, and my project for my degree was in relation to essentially social boundaries in young adult females with Down syndrome as a foundation for sexuality education. It's kind of a mouthful, but that all stemmed from the desire to come out with some type of curriculum in which clinical providers, both nurse practitioners, physician assistants, physicians, or even just, anybody that sees or cares for individuals with special needs, that they could address sexuality in a healthy manner from more of a clinical perspective. And through my initial lit review and research, I was unable to really locate any specific content for the clinician to implement directly into clinical practice. So I took on a pilot study in which I found your curriculum, Leslie, which I'm so grateful that you developed this because it was absolutely perfect. That curriculum being the Circles curriculum, which helps to teach essentially social boundaries to individuals with special needs. And I realized that this is the foundation for sexuality education. If an individual cannot comprehend the difference between a relationship with their parent versus their best friend versus an intimate partner versus a stranger down the street, you can't begin to have a conversation about the complicated abstract concept of sexuality. So I really had to focus on that foundation, and that's where my pilot project or my pilot study came in, where I utilized the Circles curriculum app through the James Stanfield Corporation and implemented it in young adult females between the ages of 16 and 25 to essentially see before and after, would they better be able to comprehend social boundaries? And the results were really impressive. I expected it to be positive, but I was really floored at the substantial increase in recognition of appropriate social boundaries in this patient population.
And I'm so honored that you chose the Circles app as the tool to test this and to teach social boundaries to the young women that you were educating. And so were their parents supportive of that?
Yeah, that was a tricky aspect to this study. I was not sure if I would be able to find enough participants, and it was very tricky to find people in this patient population. And it's not just the individuals, but also their caregivers and or parents. In all of my subjects, the parents were the ones to participate with their child or their young adult. And I found it really interesting to see the support and the encouragement and how appreciative these parents were to know that there was research being done in this realm, because this is a very common theme for parents of individuals with or parents of young adults with special needs to worry about sexuality, not just protecting them against sexual violence or abuse, but also how do you address healthy sexuality? This actually became a thought in my mind many years ago. Actually, it was about 2 years into my practice. I encountered a young girl that I cared for. She was about 15 or 16 at the time, and she had some pretty substantial cognitive delays. And after caring for her, she asked me, and we were working on a totally separate issue with regard to pain, but she asked me at the end of her care in front of her parents, will I ever be able to have sex? And here I was, a sexual medicine expert, and I had no idea how to respond. So it opened my eyes to the idea that this is a missing link. This is a really missed area of opportunity. And then it was just a year later, as you know, Leslie, that I delivered my second daughter, and to my surprise, she had Down syndrome. So then I began a warpath to really begin this process for clinicians, because I just see day in and day out that individuals in this population, not just Down syndrome, but all individuals with special needs, are really missing out on a fundamental human right of learning about sexuality education and how to have healthy sexual relationships when they're appropriate.
And parents are the first and best sex educators of their children, but it's important that the parents be included and that they understand what their role is, not so much as a policeman, but as a supporter of healthy relationships of all kinds. Mm-hmm. So we're so glad you did this. So let me ask you this. What advice would you give to mothers and fathers of children and teens with Down syndrome or other developmental issues related to sexuality education?
Yeah, really the sky's the limit. I think a lot of societal perception goes back to years and years past, when unfortunately individuals born with Down syndrome or any other special need were believed to not have the capability of being, productive citizens. And, institutionalization was very common, and certainly early intervention of special needs services such as speech therapy, occupational therapy, physical therapy, that was not provided. Well, nowadays, things are so radically different, and we're really starting to see that what we thought was a limitation is actually non-existent for a lot of these kids and these young adults, as well as full-grown adults. So early intervention makes a huge difference in every capacity of sexuality education. And by treating your child as a parent, by treating your child as you would any other typical peer, I think that that's really critical to any aspect of education, but especially in sexuality education. The really frustrating thing is in a lot of sexual education curriculum, individuals with special needs are removed. They're not really included because they're believed to be asexual, or they're believed that it's believed that this isn't important for them to understand, and that could not be further from the truth. So push forward, be an advocate, just like you are in every other capacity of your life or of your life as a parent of a child with special needs, and be their advocate for ensuring that they understand social boundaries and sexuality education, because there are opportunities, there are tools and tricks available. You just have to seek them. So you're one of those people that individuals or parents can contact in order to expand their ability to provide these services and this knowledge for their children.
And I didn't pay for that extra plug, thank you. But Brooke, what if people wanted to get in touch with you, either to know more about the WISH clinic or about what kind of services are available that can be had in their own communities to help their young men and women, girls and boys with developmental and intellectual limitations to move forward in their lives? How would they get in touch with you?
Sure. So they can go to wishnashville.com, and that's WISH, and then Nashville.com. They can call 615-250-9265 is our office number, or contact me directly. My email is B as in Brooke, M as in Michelle. My last name is F as in Frank, AUGHT as in Tom, at ua-pc.com. So bmfaught@ua-pc.com. I'm more than happy to serve as a resource, because there's no reason to reinvent the wheel when it comes to sexuality education in this population.
Well, Brooke, I am so glad, and thank you so much for taking time from, I know, your very, very busy life to talk to me and to make this interview available to the people who are subscribers to the Facts of Life Plus newsletter. And it was great. It's been great to know you and participate with you in some of your achievement.
Thank you for your support, and thank you for all that you do.
The Mutual Admiration Society is closing the door now. I'll talk to you soon, Brooke. Thanks so much.
Thank you. Bye-bye.